Hello again, everyone. It's Dr. Khaled. I'm one of the GPs in the UK, and today I'm gonna talk to you about 5 simple tricks on what to do if you ever stuck in your consultation. Very important to bear in your minds that we are all human beings. We actually tend to have feelings during our consultation. Sometimes it can happen that you feel stuck, you feel not sure what to do next. So let me tell you first trick, which is at any point of time, if you are unsure about how to address the patient's concern. So what to do? Patient can give you concerns, but you're not sure about how to address his concern or her concern. Simple trick is by saying, okay, so once we manage to help solving your problem, your condition, consequently, that's going to help with your concern. Because imagine patient is coming to you today because of, for example, lots of itchiness. Itchiness has caused problems sleeping at night. How to help with that? If we manage to help with your itchiness, your sleeping is going to get better. As simple as that. If you ever stuck, if you don't know what to do and how to address patient concern. Of course, if you have options, this is even better. But if you are ever stuck, simply, if you manage to solve the patient's problem, patient's concern is going to be solved. First one. Second one, what do you need to do if you ever have a mental block? If you have a mental block during consultation, don't worry. This is very, very normal. But mental block can happen and you just stop. You're not sure what to ask next. Again, this is normal. But what to do, how to deal with that. You can deal with that in a very professional way by simply recapping. Recap what the patient said to you. For example, Mr. John or Mr. X. So you mentioned today that you're coming today because you're having this, and that, and you're hoping for that to be solved. Did I get that right? Okay, recap, and that will actually give you some time to think about what your next question is going to be. So think smart, think smart. Now, third one, if you have realized that you missed questions in your data gathering, and now it is your time for management. What do you do? Now, it is very important to bear that in your mind. If you are in your management part and you have a question that you wanted to ask the patient, think about it for less than a second. This question is going to change my whole management plan. If it will, then yes, at that point, you can go back and ask this question. But if it's not going to change your management plan, then forget about it, park it, leave it, and go for your management plan. Don't go back. But what happens if you want to go back? If you want to ask a patient a question that's really important and you do think that is going to change your whole management plan, is by simply saying, I'm really sorry, I should have asked you this question earlier. Okay, do you do this or do you have this or that? So this is a very simple trick, but only use it if you have ever, thought about that this question is gonna change the patient's management. Then question number 4. So if the patient's expectations are not meeting your agenda, for example, patient coming to you and the patient would like to get an antibiotic, right? But you don't think the patient needs an antibiotic. What you can do at that point, I can see why you thought that. A lot of people do, but the reason why we don't prescribe antibiotics is this, and that can cause resistance, and etc. So empathize with the patient, acknowledge what the patient is thinking about, and then let the patient know why you don't agree or why you disagree with their expectations. Okay, perfect. Last but not least, very important, if you forgot about a diagnosis. A lot of you get really stressed, and this is very normal, very natural, as we mentioned earlier. If you ever forgotten about a diagnosis, but you know what this diagnosis is, you can simply say, okay, it's a type of inflammation, long-term condition, short-term condition, or is it a kind of a common or uncommon condition where there is inflammation, there is infection in the organ, for example, if it's inflammation or infection, and then do continue by our structure, as we've mentioned before, whether or not is it a treatable condition, untreatable condition, and what happens if it's left untreated. So 5 key tricks, put that in your preparation, and you will clear PASS. So remember, you will clear PASS with UKPASS.